All right, let's dive in. Today, we're not just talking about any old medication. We're going to profile a highly specialized agent that goes on a secret mission inside our bodies. Its codename, Fluconazole. And its target is a hidden enemy that can be surprisingly tough, invasive fungus.
So here's our game plan for this explainer. First, we're going to get to know the enemy. Then, we'll break down exactly how our agent carries out its attack. After that, we'll follow its path through the body, check out its official hit list, and finally, we've got to talk about the risks, the potential for collateral damage.
Okay, so before we can really appreciate how brilliant our secret agent is, we need to understand what it's up against. We're talking about fungal cells, these microscopic invaders that can cause all sorts of trouble, from a simple yeast infection to a really serious, life-threatening disease. Now, to beat any enemy, you've got to find their weak spot, right? Well, for a fungal cell, that weakness is in its defenses. See, it builds its outer wall, its cell membrane, with this unique material called ergosterol. You can think of it like the special mortar holding all the bricks of their fortress together. It is absolutely critical for the fungus to survive, which of course makes it the perfect target for a saboteur.
And that brings us to the mission itself. How exactly does fluconazole pull this off? Well, this isn't some brute force, knock the door down kind of attack. Oh no, this is elegant. It's a tale of precision sabotage. The whole operation happens in 5 super clean steps. First, our agent, fluconazole, slips inside the fungal cell. Then, it zeroes in on one very specific target, the enzyme that's in charge of making that ergosterol mortar. By jamming up that enzyme, it completely stops production. And without any new mortar, that fortress wall gets weak, it gets leaky, and eventually the whole structure fails. The threat is neutralized, simple as that. Now, here's the truly genius part of the whole thing. It's selectivity. You see, our own human cells, they use cholesterol to build their membranes, not ergosterol. And fluconazole is engineered to be a sharpshooter. It's designed to bind super tightly to the fungal enzyme, but it pretty much ignores our human enzymes. What does that mean? It can launch this devastating, targeted attack on the invader while leaving our own cells almost completely unharmed. It's brilliant.
But look, a precision weapon is totally useless if it can't actually get to the battlefield. And this is where fluconazole really shines. So let's follow it on its journey through the body and see what it can do. First off, its ability to get into the system is just incredibly efficient. I mean, when you take it as a pill, more than 90% of that dose gets absorbed right into your bloodstream. Think about that. It means a simple pill is almost as powerful as getting an IV drip. That's a massive advantage for treating patients. And once it's in the bloodstream, it goes everywhere. It gets deep into just about every tissue you can think of. I mean, look at this. It reaches levels in your spinal fluid that are 70 to 80% of what's in your blood. That ability to cross the blood-brain barrier is a huge deal. It's what makes fluconazole a frontline hero against really nasty infections like cryptococcal meningitis, because it can fight the fungus in places where very few other drugs can even go. And get this, it's got serious staying power. With a half-life of around 30 hours, this agent stays on the job active in your body for a long time. The practical benefit of that is huge. It usually means patients only need 1 dose a day, which makes it so much easier for people to actually stick with their treatment plan. Now, like any good special agent, this one has its specialties. It doesn't just go after everything blindly. So we need to take a look at fluconazole's official hit list, the specific enemies that it's been trained to take down. You can see here fluconazole is an absolute master when it comes to Candida albicans, which is the #1 cause of most yeast infections, and Cryptococcus neoformans, that nasty bug that can cause meningitis. But, and this is really important, you have to know its limitations. It's got basically no game against molds like Aspergillus, and some types of yeast like Candida krusei are just born resistant to it. In any mission, you gotta know you're using the right tool for the right target. Of course, no mission is ever completely without risk. So now it's time for the debrief. We have to talk about the potential for friendly fire, the side effects, and the really important warnings that come with this drug.
Okay, so for most people, the good news is the collateral damage is pretty minimal. The most common side effects are things like feeling a bit nauseous, a headache, maybe a skin rash. Usually these are pretty mild and totally manageable. The biggest, most serious risk, though, doesn't actually come from fluconazole by itself. It's about how it plays with other drugs. See, fluconazole is a potent inhibitor of key enzymes in the liver, especially these ones called CYP2C9 and CYP3A4. Just think of those enzymes as the liver's cleanup crew, the ones responsible for breaking down and clearing out medications from your body. Well, fluconazole basically tells that cleanup crew to go on a long coffee break. And when that happens, the levels of other drugs can suddenly skyrocket, and that's when things get dangerous. For someone on a blood thinner, like warfarin, it can seriously increase the risk of bleeding. If you're on certain statins for cholesterol, it could lead to severe muscle damage. This is exactly why a complete medication review with your doctor or pharmacist is absolutely non-negotiable before you even think about starting this drug.
And really, this kind of brings us to the single most important takeaway. Fluconazole is an incredibly powerful and effective agent, no doubt about it. But all that power comes with a big responsibility. Its success, and more importantly, its safety, are completely dependent on using it wisely and being informed.
So that leaves us with one final thought to chew on. A drug like fluconazole was a massive leap forward, right? A smart drug that could intelligently target an enemy while sparing the host. It just makes you wonder, what kind of incredible missions will the next generation of these smart drugs be able to accomplish? What's coming next?